This is about 5 mad things I've noticed about the NHS, about Britain's National Health Service. First of all, doctors are paid to give us diseases. A doctor in general practice gets a flat payment per patient per year, and the payment goes up when a patient is diagnosed with a long-term disease, and this is called an incentive, but really it's a bribe. We bribe doctors to give us these long-term things like asthma, high blood pressure, diabetes. Those are the favourites, and they're always inventing new ones like COPD, chronic obstructive pulmonary disorder, which means a bad cough, or depression and anxiety, which aren't diseases, they're experiences, they're setbacks, they're part of life. So we're bribing doctors to tell us that life is a disease. Mad thing number 2, when a hospital neglects the patients are punished. A hospital may miss its target on operations, and its punishment is a fine, which is not paid by the doctors or the nurses or the managers. Their salaries are protected. The fine is taken from the budget, which is for treating patients. So if the budget is reduced, then the number of treatments is reduced as well. It's as if they're saying to us, sorry we cancelled your wife's operation, so to even things up, we're cancelling your operation as well. Or, we're sorry we killed your aunt. Is she married? Is there an uncle involved that can help us to redress things here? And so the third mad thing is the royal family, and the NHS seems to have more royal patrons than any other body in the United Kingdom. There are royal colleges of doctors, royal colleges of nurses, of obstetricians, of gynecologists. There are 18 of them in all. So clearly the chief sponsor of the NHS is the royal family, but the royal family never uses the NHS. They shun the NHS except when a new unit is being opened, and they will send along a princess to pull a little string, and the velvet curtains will go back to reveal a carved memorial. On this day, Her Royal Highness graciously left this unit, never to return. Mad thing number 4 is that the staff don't trust the health service. There are 1.7 million staff working for the NHS, many of them in a trade union called Unison, which has 450,000 health workers, and it offers them private health insurance. It actually says on the website for £292 a year you can, and this is a quote, bypass lengthy NHS waiting lists, which they should know all about. In other words, if you think your colleagues are going to treat you well, think again, go private. And the fifth mad thing is terrorism. The NHS is the first public body to overtly embrace terrorism. I'm talking about the doctors' strike a while back. Junior doctors walked out, 55,000 of them, all out strike. They refused to administer care. Now, is that terrorism? Well, threatening the lives of innocent civilians is definitely terrorism if it's done for political ends, which this was. The issue was Saturday overtime. They were being paid, but they wanted more, and the government said no, and their officers said, well, we're going to fight to the death on this one. Not our death, obviously. Now, you might say that the terrorist doctors didn't really mean any harm, but the government thought they did, and they sent out a message to hospitals saying that the terrorist doctors could be tempted back to work if a hospital declared a major incident, i.e. a terrorist attack. So the only remedy for terrorist doctors was real terrorists. But there's a difference in scale. Real terrorists have big ambitions. Give me world power or you die. Doctor terrorists have rather smaller ambitions. Give me extra Saturday money or you die. So I think I've got more respect for the real terrorists.